Hi, this video is the FUE demonstration. FUE is pulling one hair at a time. It's a different form of surgery. It's the most advanced and least invasive of the two available. When you compare that to the strip method, cutting a whole strip of skin with hair and suture you up, the strip would result in a linear scar. The FUE would leave you tiny dots of scar scattered throughout the back like a mosaic pattern, allowing you to wear your hair shorter. This video will demonstrate what the FUE is about, pulling one root at a time. FUE is the most advanced again and the least invasive. It's not only leave you minimal scar, but leave you less bleeding, less chance of infection. Bleeding is relatively different. No scalp tightness when you compare the strip method. FUE is the future when you compare that to the FUT or the strip method. More and more people are opt for the FUE because it's less invasive, less painful during recovery. I do both FUE and the strip. The FUE is more for patients with mild to moderate hair loss, up to class 4. Although 5, 6, 7 can be done, you just need to know that it's a multiple session and getting toward the back. Compare that to the strip method. The strip method for a client with completely advanced hair loss, 5, 6, or 7. The benefit of the strip over the FUE is you can remove large number of grafts per day, like 5, 6, or 7, and it's cheaper, of course, because it's more efficient. But it results into a linear scar. The linear scar is hidden unless you shave your head, but you leave your hair long, it's not a problem. Okay, here's the demonstration. So we do tumescent. What's the benefit of tumescent? Tumescent has 2 benefits. Number 1, it holds the hair follicle taut so it doesn't move around a lot, so then less chance of movement and then less chance of transaction. The other one is to lift the scalp up so you won't damage the root or underlying tissue. So here's the demonstration here. I use both the motor and the manual. And with my FUE, I'm actually personally doing the surgery, pulling one hair at a time. So here. And then we use the forceps to pull the hair graft out. Why the forceps? So people are gonna both like this. Okay, go ahead with this outside and because if you do suction and all this stuff, it will dry it up and damage the root. Okay, you see that one? Blot. See another one. It's slightly bent. It's clean. Interesting. Oh, blot. Keep it in. That's the FUE, okay? FUE, now there's a difference between FUE performed by a surgeon who specializes in FUE versus the clinics that are not specialized in FUE, and they are some they just buy 2 machines that are more the robotic Gatos versus the knee graft. The knee graft mostly the technician operating on you. The quality is really different, of course. Imagine a technician is designing your hairline, and technician pulling one hair at a time, versus the surgeon is sitting there pulling one hair at a time. Quality is different. And then you have the robotics, again, so the surgeon cannot physically sitting there pulling one root at a time by the robotic machine. And of course, even though they claim would be less transaction and better result, but it's not really. If it is, I will buy 10 machines that collect. So I don't have to, sitting there pulling one root at a time. So the robotic doesn't produce as great result as when a surgeon actually sitting there pulling one root at a time. The surgeon will understand the depth, how wide the root is, how long, and how deep the hair follicle is, at what angle. So there's quite a bit of depth of knowledge need to be understanding, and then the type of skin. So with me, I will be personally pulling one root at a time. And you can see my result of FUE before and after. Just go on YouTube, type of FUE hair transplant restoration surgery result before and after photo by Dr. Diep. Thank you.